going to sit for an exam. So detailing of this is not needed. Just read out what have been labeled, all right, and take the clue how you can label this diagram if you draw in the examination, all right. This is the muscular partition formed by the lower fibers of the T7 to T12 vertebra along with the fibers from the xiphoid process, all right. The space around the xiphoid, if enlarged, this is called the space of Larry. This is called space of Larry. And if the apertures are much enlarged, this is called foramen of Bochdalek. This is called foramen of Bochdalek. Now, these areas are blocked, not the xiphoid area. The foramen of Bochdalek, that is coming in between the mesoesophagus and on either side of the mesoesophagus, and this is the diaphragm. This is the mesoesophagus and this is the pleuroperitoneal membrane in between the pleuroperitoneal gap, and that is covered by the pleuroperitoneal membrane. In case of abdomen, this is covered by the pleuroperitoneal membrane, and in case of thorax, this is by the pleuropericardial membrane. As you can see, the coelomic duct, the pericardial sac, the gap between the pericardial sac, the coelomic duct, that is the pleuropericardial opening, and the gap between the pleura with the peritoneum is the pleuroperitoneal opening. These are blocked by the corresponding dissected part from the thoracic wall by the developing lung. Developing lung is dissecting out a part of the thoracic wall that is going to cover the pleuroperitoneal or pleuropericardial part by the side of the esophagus, which is called mesoesophagus, So the opening on either side of the xiphoid process, the muscular opening, muscular fiber, and on the either side of the muscular fibers of the xiphoid process are called space of Larry, and when it is enlarged, it is called foramen of Bochdalek, and the rest of the membrane, that is the pleuroperitoneal or the pleuropericardial gap, is covered by the dissected part of the thoracic wall by the developing lungs. All right. Did you understand this? The structure is shown that there is the central tendon, muscular fibers, tendinous fibers in the central part, where there is the vena cava opening, and within this the muscular crisscross, the cruciate tendinous part, and below that is the phrenoesophageal ligament. Actually, it is the part that is covering the esophageal opening, that is called phrenoesophageal ligament, and below that is at the level of T12. Esophageal opening is at the level of T10. Vena cava opening is at the level of T8, and abdominal aorta is at the level of T12. That is the median arcuate ligament. It is in the median arcuate ligament, and as you see, by the side of the median arcuate ligament, there is the medial arcuate ligament, and then lateral to it is the lateral arcuate ligament. That deep to it is the subcostal vessels and nerve passing to the lateral side. I don't know whether you have seen the cutout diaphragm. Is there any specimen in our anatomy practical room? I don't know. আছে আমাদের anatomy practical এ, তো practical room এ diaphragm কাটা আছে, part আছে? হ্যাঁ, ক্যাডাভারে আছে, আচ্ছা, কিন্তু ক্যাডাভারে দেখতে পারবে তোমরা? কাটা হয়নি এখন, ফ্রি আছে এখন। অল রাইট, ইট ইজ ভেরি নাইস। So you must check out in which level what nerves are passing out, that is from the lateral arcuate ligament deep to the lateral arcuate ligament. You can see the subcostal vessels and nerves are coming out. Like this, we will check out for the other vessels and nerves that are present in relation to the diaphragm. And you can see that in between the median arcuate ligament, that is the lower part, in between the two crust of the diaphragm, there is the abdominal aorta passing through, and the vagus is also coming out, and the sympathetic chain that is giving rise to that I have drawn T5 to T9, T10, T11 and the T12. T5 to T9 is the greater splenic nerve, T10 to T11 it is the lesser splenic nerve, and T12 is the least splenic nerve. You have to find out through which aperture these nerves are entering from the sympathetic chain to the thorax, right? And what are the fibers taking part in formation of the phrenic nerve? In formation of the phrenic nerve, that is the C3, C4, C5. As during the development, the myotome comes from the C3, C4 and C5. So the nerve supply to the C3, C4, C5 remains as the nerves of the diaphragm. That is the phrenic nerve. You got my point? That is, when it was developing at the level of C3, C4, C5, the fibers attached to C3, C4, C5 nerve remains unchanged. The nerve supply doesn't change when the diaphragm comes down. When the diaphragm descends down, its nerve supply doesn't change. Its myotome remains fixed. So the phrenic nerve has the same myotome that was at the level of cervical part, then it came down in the lower thoracic and upper lumbar part. Got my point? Now you should try out to find the labeling, because this might come as a question. This might come as a question. So try to read. If you have any trouble in reading the labeling, you may ask me. Now, what is the time now? Tell me the time. কটা বাজে গো? হ্যাঁ, 9? 9:40. All right, your roll call has been done. Your attendance has been taken. Attendance নিয়েছো? Oh, it's all right. Okay. So let me allow some time for them and leave the class. Okay. I conclude here. You take the discussion through labeling. Take the labeling and you will be able to find out what is the discussion in relation to the diaphragm. ठीक है जी? Diaphragm is an important topic for your examination. Diaphragm is an important topic for your examination, and you should know how the diaphragmatic fibers are going to form the dome. How the diaphragmatic fibers are going to form the dome. The highest part of the summit of the dome is called the capola. That is called the capola, right? And in the lower part, you can see by level, that is the vena cava opening by T10, esophageal opening by vena cava opening by T8, esophageal opening by T10 and opening of the abdominal aorta is T12, all right. And you should find out where is the right cusp, where is the right vagus, where is the left vagus, where are the fibers of the splenic nerves. You should find out the opening and the structures that are passing through. That is needed. This will be asked in the examination. This will be asked in the examination. Okay, you let me conclude here.